Hi, my name is Dr. Philip Boob, and while you're taking this stress test, I'm going to explain the test that you're actually taking. Did you know that 30% of people that have heart disease, their first symptom is death? And did you know that 50% of people that have heart attacks have normal cholesterol levels, even by conventional medical standards? That's because we've put too much emphasis on cholesterol and not enough emphasis on inflammation. Inflammation is actually what damages your artery wall and allows cholesterol to build up. It's not a matter of how high your cholesterol, it's a matter of how high your inflammation is. The metaphor I like to use is inflammation damages the road like potholes in the highway, and if the Mack trucks crash because of the potholes, it's not the Mack truck's fault carrying the cholesterol, it's the inflammation, the potholes in the road that cause them to crash. Cholesterol is guilty at the scene of being built up in the artery wall, but it's only because inflammation allowed it to be there. So too many doctors are looking at cholesterol and not enough are looking at inflammation. So what this test is actually looking for is it's looking for inflammation in that blood vessel wall, and the way it's doing that is it's measuring how well your arteries expand and collapse. What you may not know is that although the heart beats and pumps blood all around the body, every artery must beat with the heart in order to keep blood flowing. So what this test you're taking can do is it can evaluate how well your arteries expand and contract with each heartbeat. And with every heartbeat, it's giving you a wave of either type 1 all the way through type 7. And by the time the machine is done, what it's going to do is it's going to give you a percentage of how many heartbeats landed in each category. You want a type 1, and type 7 being the worst. But if you're somewhere in between, that can tell you how at risk you are. And if you're anything but a type 1, you are considered abnormal, and it's saying those arteries are aging, and you should seek out a functional medicine doctor to get evaluated for inflammation. So this is the example of one of the tests reading out, and you can see that it's saying you are 100% type 1, and that's great. This bar over here shows how stressed you are compared to how rested you are. You want an even red and blue bar because it's saying your fight or flight system is nice and balanced to your rest and digest system. This second person, you can see that their type is actually a little bit worse. They are type 2, 100%. That's still mostly normal, but that's still not perfectly normal. You want to be 100% type 1. And then this person, you can see they scored a type 3, but they still had some numbers in type 4 and type 5, and that's at quite risk. And then this last person I'll show you an example of is a type 4, 86%. So with this stress test, you want 100% type 1, and you want to make sure that your inflammation is clear in your blood vessels. If you're showing any signs of abnormal, you should seek out a functional medicine doctor to get evaluated further. Here in my practice, we do a lot of inflammation testing in order to find disease before it actually happens.